Mrs. Princey, Associate Professor in Mental Health Nursing. I've got a case of a 7-year-old boy who is the only child to his parent. He's studying in grade 1. He's an intelligent and caring young boy who performs, well in the academics. But he often has these, complaints such as getting upset when he does not get the recognition and that when he feels that he's being ignored. So when he goes to the school, the teacher has recognized few of the characteristics of the boy wherein he seems to be socially immature, where he often demonstrates the behavior of attention seeking. The teacher recognized that he often had difficulty sitting in the class as well as sitting still in the class. Sometimes he becomes very much hyper focused on few of the activities wherein he starts to show the hyperactive kind of the behavior, and his teacher describes him as being constantly running around the class, right? And also a peculiar feature that the teacher noticed is that he had an impatient to wait for his turn to answer. So whenever a question is asked in the classroom, he blurs out the answer before the question is completed. That the teacher had noticed of this boy. Yes, so by understanding these changes in the behavior or the characteristic feature, you would get a chance to guess the topic. So what do you think is the topic? There is a problem with the attention. The child is very much hyperactive. He always seeks, for the attention. Yes. So the condition here, which I'm going to talk about, is the attention deficit hyperactivity disorder. So it is one of the most common, childhood psychiatric disorders. Okay, we have got list of childhood psychiatric disorders wherein there is a disturbance in the behavior and emotional aspect. One of the disorders is the attention deficit hyperactivity disorder. Yes, the topic for today, which I'm going to discuss, is the ADHD. Attention deficit hyperactivity disorder is also termed as hyperkinetic disorder because the child is very much, hyperactive and is not able to sit still in one place. He keeps on moving. That is what is called as hyperkinetic movement. Okay, he keeps the movement, to such an extent it's too much compared to the other children of the same age. It is one of the childhood psychiatric, disorder. ADHD is marked by developmental inappropriate attention, impulsiveness, as well as in some cases hyperactivity. So you can understand the key feature of the ADHD disorder is the inattentive behavior, the impulsive kind of the behavior, as well as the hyperactive behavior. So it is very, very important that such a condition to be identified during the earlier stages itself, especially when the child is at home and when the child goes to school. School is the place where the child spends most of his time. So these kind of the, abnormal behavior are to be recognized by the teachers, or at home it has to be recognized by the parents so that, you can treat the condition as early as possible, because this hyperactive kind of the behavior can lead to the conduct disorders later on in the life of the child, and also it can predispose a variety of psychiatric disorders where there will be impairment in the relationship, family function. He may even end up with the depression. So to avoid those complications, it has to be identified in the earlier stages itself so that you can treat the condition. It is noted that most of the children, develop this ADHD by the child is 4 years old. You can actually notice the signs and symptoms, but they are not diagnosed until they enter the school. So only when they enter the school will the teacher be able to identify that this particular child is not normal compared to the other children. Yes, maybe he is very much hyperactive, he lacks the attention, whereas when it is compared to the same age group, okay, that is the time when they usually understand there is a problem with the child. Yes, so this is very, very important to be identified. So let us see the definition of ADHD, attention deficit hyperactivity disorder. ADHD is otherwise termed as the hyperkinetic disorder, or sometimes it is termed as attention deficit disorder, which involves hyperactivity, difficulty in focusing or the attention, as well as tendency to act impulsively. Right? So, what do you understand by tendency to act impulsively? It is nothing but without even understanding the consequence of a particular behavior, the child simply does, whatever he wants to feel like. It can be to such an extent that it may harm himself or it may harm the other person, but is not able to analyze that. So he acts immediately to whatever impulse that he has, right? So that is called as the impulsive act. Without even understanding the consequence of the behavior, the child will perform that particular act, right? So this is the definition of ADHD. Moving on to the epidemiology, yes, so it is found that there is a prevalence rate of 1.7 percentage in the primary school children, that is, they suffer from the ADHD condition. Most commonly, it is seen in the male child compared to the female child. So the incidence is higher in the male children. Moving on to the types of the ADHD, mainly it is classified into three types. Number one, it is predominantly inattentive ADHD. So here you can notice the symptom of inattention. So ADHD is attention deficit hyperactivity disorder. In this, the predominant feature which you can notice is the inattention. So that is the first type of the ADHD. The second type of the ADHD is the predominantly hyperactive or impulsive type of the ADHD. Here you can notice that most of the dominant feature is the child is very much hyperactive or he will have the impulsive kind of the behavior, whereas the attention span that he can maintain to some extent. But the dominant feature is that he is very much hyperactive or impulsive. That's the second type. The third type is a combined type of the ADHD, where there will be features of both inattention, hyperactivity, or the impulsive kind of the behavior. So these are the three major types of the ADHD. Let us see each of it in detail. So number one is the predominantly inattentive type or inattention type of the ADHD. What are the characteristic features? So the primary characteristic feature here is the child will have difficulty paying the attention. So he gets easily distracted. He cannot focus on one particular task. So whatever task you give to the child, it will end up being incomplete. Right? So that is the first and foremost important feature where there is a problem or difficulty in maintaining the attention. The second characteristic feature is the child will find it very difficult or he will struggle a lot to concentrate on a particular task or to even complete the particular task. He may forget or he may get easily distracted. So that is the second characteristic feature. The third feature is the child lacks the organizational skill. Right? So he may not be in a place to have an organized way of following or organized way of doing things. So he lacks or he has got a poor organizational skills. Most of the time he seems to be lethargic, sluggish, shy, anxious and constantly daydreaming. So such a kind of feature that you can notice in the children in other areas wherein they most of the time spend the time in their daydreaming. They seem to be very much shy, sluggish, lethargic, and also the organizational skills are very much poor. So now, how do you diagnose the condition? According to the American Psychiatric Association, if the above features the child is having, that is at least 6 features, if the child is having persistently for a period of 6 or more months, then you can diagnose the child as having ADHD, predominant feature as inattentive type. This kind of the ADHD is most commonly seen in the adolescent girls. So this is about the first type of the ADHD, predominantly inattentive type. Moving on to the second type of ADHD, it is predominantly hyperactive or impulsive type of the ADHD. So as the name says here, predominant feature is the child will be very much hyperactive, or he will have the impulsive behavior or the acts. Here, the child will have difficulty in controlling his behavior. So, he may not be in a place to control his impulses. Most of the time, he appears to be very much aggressive in nature. He may have the features of oppositional defiant disorder. That is, he may not obey the rules and regulations which are there in the school or at home. He just does the opposite of the norms. That kind of a behavior you can notice. He is at more risk for ending up with the conduct disorders, and also he will develop the antisocial type of the personality. What are the hyperactive kind of the behavior? He just fidgets and is excessively restless. So fidgets, he just keeps fidgeting his fingers or legs, he just keeps doing that, or is very much restless. Even at school, he will scream in his seat. He doesn't sit in his seat. He does all such kind of a restless movements that you can notice. So these are the hyperactive kind of the behavior that you can notice. Another feature is the child will blur out the comments that are very much inappropriate, and often he does not think before he acts. Okay, say for example, if a teacher is asking a question, okay, before the question is completed, he will blur out the answers, right? So such an impatience that the child will have. Even when I told you the case history in the beginning, okay, the child had this kind of the problem, that is the impatient to wait for his turn. And also the behavior, whatever he does, he doesn't even think about the consequence of it, which shows the impulsive kind of the behavior. So how can you diagnose the condition? If the child is having 6 or more of these above mentioned symptoms for persistently a period of 6 months, you can diagnose the condition as ADHD, wherein the predominant feature will be the hyperactivity as well as the impulsive acts, right? So that is the second type of the ADHD. Moving on to the third type of the ADHD, which is the combined type, okay? So combined type is nothing but the child will have the features of hyperactivity, impulsive behavior, as well as the inattention, right? So that is the combined type, type 1 as well as type 2 ADHD. What are the characteristic features here? So here the characteristic features include both those symptoms of inattentive type as well as the hyperactive and impulsive type. Okay, it is the most common type of the ADHD among all the types. It is especially seen in the boys during the elementary school age period. How to diagnose the condition? If the child is having 6 or more of the symptoms of the major 2 types of the ADHD persistently having for a period of 6 or more months, you can diagnose the child as having the ADHD, which is the combined type. Okay, so these are the 3 major types of the attention deficit hyperactivity disorder. Right. Now, moving on to the cause or the etiology of ADHD, what may be the reasons? Okay, we have got various reasons why a child will develop this kind of the changes in the behavior. Number one, we have got the biological influence. So under the biological influence, the first and foremost thing is the biological factor. So the biological factor explains that it is most commonly seen in the monozygotic twins than the dizygotic twins if you take the twins. And also siblings who already have this condition of ADHD are at more risk of developing the ADHD condition. So say for example, if the first child is having the ADHD, the second child is at more risk of developing the same condition. It is also noted that the children who are born from the biological parents are at more risk of developing the ADHD than the adoptive parents, right? So obviously, because the biological parents, there is a genetic predisposition maybe which contributes to the condition wherein the child may develop. If you take the adoptive parents, there are somewhat external parents who may not contribute much, right? So this is the first factor under the biological influence, wherein there is a role of the hereditary as well as seen most commonly in the monozygotic twins. Siblings who have got the ADHD are at risk of developing the ADHD twice compared to the general population. The second factor on the biological influence is the biochemical factor. So we have got some kind of changes in the neurotransmitters, especially the norepinephrine as well as dopamine. If there is a deficiency in these two neurotransmitters, you can notice the overactive kind of the behavior in the children. The next factor is the pre, peri, and the postnatal factor. So it is nothing but the perinatal factor. So during the pregnancy of the child, right? So or during the delivery or the postnatal period. So any changes or any kind of the factors can influence, the mother to give birth to a child with the ADHD. So if you take the prenatal factors, we have got in the mother, right? If the mother has developed any kind of exposure to the toxic, it can have an influence on the child, right? Or it can be mechanical insult during the pregnancy, any kind of a physical, injury or mechanical injury to the mother when the child is being there in the womb. So such a child can have the ADHD condition later on, especially when the child is having an insult to the nervous system, maybe the accidentally an injury to the mother's womb, or wherein the fetus may have the injury to the nervous system later on when the child is born, he may be at risk of developing the ADHD. So that is the prenatal factor. Second thing is the perinatal factor, so that is during the time of the delivery, something which is related to the labor. If the child is a premature child, so before the completion of gestation period, okay, if the child is born prematurely, such a child may be at risk of developing the ADHD. If the child had experienced the fetal distress, it in terms of prolonged labor, when the mother is into the prolonged labor, the child may undergo some kind of a fetal distress or any condition wherein there is a deficiency of oxygen to the fetus, wherein the child may have the fetal distress. Or in case of precipitated labor, so precipitated labor is nothing but the delivery happens within a short period of time, right? So during that time, accidentally, without even the knowledge of the mother, immediately the mother may deliver the child within 1 or 2 hours. So proper precautions are not there to receive the child. Okay, so in such conditions, accidentally it may injure the child's head, okay, wherein it causes an insult to the nervous system of the child. Later on, such a child may develop the ADHD. Other factors like perinatal asphyxia or low Apgar score, okay, when the child is born with, then such a child may be at risk of developing the ADHD. What are the postnatal factors which influence ADHD? Conditions such as postnatal infection, any kind of CNS abnormalities which the child may develop because of the trauma, right? So such a condition wherein the child may develop ADHD in the later period of his life. So this is about the pre, peri, and the postnatal factors which is contributing to the ADHD. So that is the first, cause or the etiology, which is the biological influence, which talks about the biological factors, the biochemical theory, as well as the perinatal factors. Second cause is the environmental influence. Certain conditions in the environment influence the child to develop the ADHD. Exposure to the environmental lead, food additives, coloring agents, and also the sugar levels, right? So if the child is given lot of sugary items, when the child is exposed to such a kind of an environment, there may be a chance that the child may develop the ADHD later on in his life. The next one is the psychosocial factors. So what are these psychosocial factors? Number one is the prolonged emotional deprivation. Okay, the child is not given appropriate or complete affection or the emotion. Prolonged, for a long period of time, there is a deprivation. Maybe the lack of the motherly figure or the loss of the parents can lead to this kind of a condition where there is a chance that he may lack the emotion for the time during the childhood period. So such a child can develop the ADHD. Any kind of the exposure to stress or psychic events or the disruption of the family equilibrium even causes the ADHD. So these are the psychosocial factors contributing to the ADHD. Moving on to the risk factors of ADHD. Number one is a drug exposure in utero. If the mother is exposed to any kind of the drugs, okay, during the pregnancy, so such a child can develop the ADHD. Birth complication or low birth weight, as well as exposure to the lead or the lead poisoning. So these are the risk factors. If the child is exposed to such kind of factors, they may develop the ADHD in their life. So that is the etiology of ADHD. Moving on to the signs and symptoms of ADHD. So the signs and symptoms are mainly classified into three. One is the symptoms of inattention. The second one is the signs and symptoms of impulsivity. And the third one is the signs and symptoms of the hyperactivity. So these symptoms of inattention, impulsivity, hyperactivity usually is seen when the child is intensified with boredom or when it requires the concentration or attention to be paid on a particular task for an extended period of time. So that is when the child will start exhibiting these symptoms. So let us see each of these symptoms in detail. The first one is the inattention. The child with the ADHD will have a shorter attention span. He may not be in a position to even listen to you, right? So whatever you're going to say, even those things that a child may lack to store in his mind, right? He doesn't keep anything. The child will lack to keep anything in his mind. Okay, so that is the first symptom of inattention. That is, there is a lack of the attention, the inability to listen, inability to retain any things which is being told. Such a child will get easily bored. They cannot concentrate on one particular task. Within few minutes, they will get distracted and they will leave the particular task and move to the next one. So such a kind of a boredom that they'll feel, and they feel tired of focusing on one particular task. Another peculiar feature that you can notice is, yes, even the child has the inattention, it is not for all the activities. If the child enjoys that particular task or enjoys a particular activity, he is able to, focus on that and he will be able to complete the task. But they lack this inattention when they want to have a focus on the particular task, especially in terms of organization, when he has to learn something new. So it is those situations which makes the child, very much difficult to focus. So this kind of the inattentive behavior makes the child to forget, lose various things, and also make careless mistakes. So that is another feature that you can note. Okay, they will miss so many things of theirs, they will forget, and there will be a lot of careless mistakes that the child will do. Other features that you can note is the child will fail to follow the instructions, he will fail to complete the task, he gets easily distracted, and he will be very much reluctant, or he will try to avoid the situations wherein the focus is required. Right? So these are the symptoms that you can note in the inattentive type of these signs and symptoms. Second one is the impulsive, signs and symptoms. The child with the ADHD will have trouble curbing their immediate reactions. So that is, they will not be able to have a control on their impulses. Immediately they give the reactions. They act before they think, so they don't even think what may be the consequence of a particular act. So before they even think itself, they would have performed the action. Most of the time they interrupt others in terms of blurting out the inappropriate remarks or answering questions before the question is being completed. Another thing that you can note is the children have difficulty to wait for their turns, or to wait for the he sees to it that he does it first, right? So that is a kind of a impatient behavior that the child will show. At times, they may get very much upset. They may grab the other child's, toy, or they even involve in the physical fights with the other children. So these are the impulsive behavior that you can note in the child with the ADHD. Is the symptoms of the hyperactivity. Children with ADHD are always on a go. Okay, they keep moving here and there around without any intention, and they lack to even sit in one place. They try to do several things at a time. So, okay, they are not able to sit still. They touch so many things at a time. They want to do so many things. So such a kind of a restless behavior the child will exhibit. If you take in the school, the child will just scrim in his seat. He is so much impatient to sit, still in his seat. He keeps moving around the room and talks excessively. So these are the hyperactive kind of the behavior the child will show. They have a lot of trouble to engage themselves in activities which are very quiet or calm going. Also, you can notice such a child will not be able to, complete the total class itself. That is, it is impossible for the child to sit in a class completely for a complete duration. Some of these children even tap their pencils, instantly they'll be playing with the pencils, they'll be wiggling their feet, and they'll be touching everything that they see. Right? So these are the signs and symptoms that you can notice, which is related to the hyperactive behavior. So the signs and symptoms of ADHD are mainly classified into three. One is the signs and symptoms of the inattention, impulsivity, as well as the hyperactive behavior. Moving on to the diagnosis of the condition. So how do you diagnose? You're going to do a complete medical evaluation. You're going to collect the history from the family, from the parents, from the teachers. You're going to do a mental status examination, neurological examination you're going to do. And also you're going to test the hearing and vision of the child. You're going to do a psychiatric evaluation where you're going to check the intellectual ability of the child, academic performance of the child, the difficulty in the learning aspect or developmental, learning disorders that the child is having, that you're going to rule it out. You're going to collect detailed prenatal and early developmental history. So you know the cause during the perinatal factors which can contribute to the development of the ADHD. So you're going to collect the perinatal history as well as the childhood history, especially the developmental milestone history that you're going to collect. You're going to do the direct observation. You're going to notice the child, so you know the symptoms of inattention, impulsivity, as well as the hyperactivity. So you're going to directly observe the child. Okay, when you look at the child, he may exhibit one or the other kind of the behaviors which is related to the ADHD. Right. Apart from that, you're going to get a report from the school teacher. So very, very important, since most of the child spends his time in the school, right? So important to get the history of the child from the school teacher, when the teacher may just report the behavior of the child in terms of hyperactivity, inattention, lacking the focus, or screaming in the seat, not staying in a complete class, okay, not waiting for a turn. So such kind of an history from the school teacher, that you may get a report, as well as you're going to collect the report from the parents. So at home, how is his behavior? How is his behavior towards the sibling? How are the activities that he does at home? So any kind of abnormalities the parents note. So those history that you can take it. So with all these things, you're going to diagnose the condition of the child. Right. So that is about the diagnosis. Moving on to the treatment. So what is the treatment for this ADHD? We have got the use of pharmacological agents as well as psychological therapy. So especially the children with the ADHD will be given some of the drugs. We have got the we have got the CNS stimulant group of drugs. Example, dextroamphetamine drug. We have got methylphenidate as well as the pimolin. We may use the antidepressant drugs which belong to the TCA cycle. We've got the antipsychotics, SSRI group of drugs, as well as the clonidine. So these are the various drugs that you can use for treating the ADHD, but most of the time we don't prefer the child to put on all these antidepressants, antipsychotics. So if the symptoms are very much severe, okay, wherein it is going to trouble the child as well as the others around, then we may indicate some of these medications. But not all clients require the medications. Okay. So moving on to the psychological therapy, which may be used for the child with ADHD, are behavioral therapy, wherein the behavior modification techniques are taught and they are being used. Apart from that, we have got the cognitive behavior therapy, social skill training, as well as the family education. Since the parents are the one who's going to take care of the child, a lot of anxiousness and fear the parents may have, right? So such family should be educated, they should be counseled related to this condition and how they can support the child to overcome the condition. So such kind of a psychological therapy can be used as a treatment modality. So that is a treatment for the ADHD. Moving on to the nursing management part. Yes, we have got a client with the ADHD in our particular inpatient department, okay, a childhood psychiatric ward. So, as a nurse, what is your responsibility? What are some interventions that you can plan for a child with the ADHD? Number one thing is, as a nurse, you should be able to develop the trustworthy relationship with the child. So you have to develop the therapeutic relationship. So when you're working with a child, you also should act as a child, or you should be as a child, right? So it's very, very important that you develop that kind of a trust with the child, so that he will be able to listen to you, cooperate with you when you give the treatment. See to it that you convey the acceptance of the child, and at times you have to see to it the unacceptable behavior should be discouraged, right? So these are the few important things that you're going to keep in mind when you're going to care for the child. The second thing is very important. As a nurse, you're going to ensure that the patient environment is safe, right? Since the child is very much hyperactive, he keeps moving around, he may not be able to sit in one place. Very, very important. The environment of the child should be safe. It should be free from all those, furnitures or obstacles when the child is moving, so that you can avoid the accidental injury. Not only providing a safe environment to the child, you have to be in a place that you continuously supervise the child in the particular environment. You may not know at what time the child may do. He is very much impulsive, right? So you need to constantly supervise and observe the child so that you can avoid the potentially dangerous situations. See to it that you provide an environment which is non-distracting for the child, since the child get easily distracted, right? So see to it that the environment that you provide, or the task or activity that you provide, make sure that the child will be able to focus and it should not get easily distracted. The next one is, before giving any kind of the instruction, see to it that you always call the child by his name, so that he will be able to pay the attention to you. So always call him or her by his name, and also establish the eye contact, which is very, very important, where the child will understand communication is important. Before a task is being initiated, you ask the child to repeat the instructions, which will ensure him like this is what he is supposed to do in this particular task. So before you initiate the task, you ask the child to just explain the instructions, and then to start the particular task or the activity. Whenever the child is able to complete a task or an activity, you give a positive reinforcement for the child, wherein the child will feel motivated to perform the various other tasks. In the beginning, when you start initiating the task, see to it that you provide assistance to the child, so that he gets an assurance that even though that he is not able to focus or is not able to do the task, that you provide him the constant assistance to help him complete the task. So eventually this assistance can be decreased, but ensuring that whenever he requires the help or assistance, you are there available, so that he will be able to complete the particular task. As I told you, whenever the child completes the particular task, you give a positive reinforcement for the child, and see to it that you reorganize such similar tasks, so that he will be able to complete the task. He gets a practice to complete the same task again and again, which will give him a motivation. You can involve the child in various group activities, okay, with the other children, wherein he will develop that social skill, like how he has to interact with the other children, how he has to behave in a group, all such things that the child will learn when the child is involving in the group activities. You provide such a kind of an environment to the child which is very much quiet and similar to that of a classroom setting. Avoid overstimulation, especially avoid him to those places which makes him feel very much excited or very much hyperactive. Say for example, the cinema theaters or bus stops or crowds, wherein he may start showing the hyperactive behavior. So avoid those places. The another important thing is you're going to help the child to learn how to take or wait for his turn, by making him stand in the line, or or making him follow the rules of a particular game. Okay, make him to understand this is what is the rules that has to be followed. This is how that you are going to wait for your turn. You're going to see that you're going to value yourself and others as well. So this is the way that you're going to bring in the child, or you're going to teach him the how to control his impulsive behavior. Since the parents will be often exhausted to be with such a child who is having a disruptive kind of a behavior, it is very much necessary that you guide the parents, you give the counseling sessions to the parents, make them realize that this is what is the need of the child, this is what is the parental skills that is required, that you support the child, and you should be able to assist them to have this intellectual, emotional, as well as the physical strengths as well as limitations. You can help educate the parents by giving them the information or the materials requiring to learn about the condition of ADHD. What are the various ways, the parental skills or the techniques that you have to follow when you care for such a child. So this kind of a information or education, message that you can pass on to the parents. You can even explain and demonstrate the parental skills that the parents should develop, such as timing for a good behavior and being very vigilant in observing or identifying the child's need, and responding positively to the child's behavior, right? So such a kind of a parental techniques are to be taught, and it has to be demonstrated to the parents, because parents are the ones who are going to be with the child for a longer period of time. So if the parental skills are modified, the child will be able to recover very fast. You're going to educate the family regarding the treatment or compliance to the treatment, as well as the various therapies. And also you're going to coordinate the overall treatment plan with the school, collateral personals, the child, as well as family as a whole. Okay, since the child even spends his time in the school, even for that matter, the teachers can put a word, the teachers can be educated that this child requires a special help or the special assistance. So those things that you can communicate towards the teachers or parents, the collateral personals, whoever are there, right? So which is going to help in the recovery of the child, right? So this is the nurse's responsibility, or a few nursing interventions that you can plan for the child with the ADHD, right? So ADHD is a very important and common condition wherein there is a deficit in the child in terms of attention, in terms of impulsive behavior, and also the hyperactive behavior the child will exhibit, which can be treated when you identify it in the earlier stages, and you provide the support to the parents and the family as a whole to help the child to recover at the earliest. Hope you all have understood the topic. Thank you.